Hello, hello, hello. I'm popping in before I head to work. Have um nope, just one shift and then I'm off, and then I will work after Thanksgiving, even though I don't really do anything for Thanksgiving. So anyway, I wanted to come on and talk a little bit about tearing. There's a lot of fear around tearing in birth. So I thought it would be good to address other things besides what you can do when you're pushing. Um, I do warm washcloths with like always running hot water over them so they're fresh and warm, and I swap them out all through the pushing um, phase if it's um, like if I'm able to, if they're up moving around and stuff, I'm probably not gonna really bother them with warm washcloths unless they want. And then I'll also use mineral oil. And so I mix the mineral oil I put around the perineum, and then I put the warm washcloth on, and I'm just doing this to help promote circulation, which helps the skin become like, softer, stretchier, and the mineral oil helps with that as well. And then the heat will help it penetrate even better. So I do that, except it's not um, inside, like, so when you tear, it's actually like kind of more internal than it is external. And that's where your muscle is. And the muscle sometimes can be restricted. There might be trigger points in your pelvic floor muscle. And this is why pelvic floor therapy before pregnancy is very helpful. So if I were to really say, in the grand scheme of things, um, things that really will help you with minimal tearing would be body work, maybe even intravaginal work, and nutrition. Nutrition is very important because if we're not getting enough protein and collagen, then our skin is not going to be, or our soft tissues, like our muscles, our ligaments, tendons, and skin, will not really be equipped to accommodate that stretch that we have to go through to birth a baby. So if you start early in your pregnancy, or even before your pregnancy, by seeing a pelvic floor physical therapist um, for pelvic floor work specifically, you'll put your pelvic floor in a good condition. But I think you're also going to learn a lot when you go see like these practitioners, because you don't just go get pelvic floor work done and walk away. You learn, you you get information maybe you've never heard about. You start doing things differently, maybe breathing differently, maybe incorporating pelvic floor um, exercises into a fitness routine that you do that you never would have thought of. So it literally will change your own approach to your own fitness. And I mean fitness as your pelvic floor health, and it's part of like the whole body. We tend to fragment the body up, and we're actually one connected unit. Things that may happen up in your shoulders can have an effect down in your hips or your knees. The fascial system does not stop at your joints. The fascial system in your body is head to toe, toe to head, side to side, all around. And that's my specialty, is the fascia system. So one of the ways or causes that we could tear is um, possibly the position of the baby. So if your baby is in maybe a not so optimal position, their head may be a little deflex, not tucked really nice, and so the molding doesn't occur as it should for your pelvis, but the baby can still fit. However, the circumference of the head becomes larger where the chin becomes more, we call a military position. So when you are when you are pregnant, doing body work is really important for creating a balance within your body. So I don't say it's to create an optimal fetal position. It's actually just to create balance in your body so a baby will lie in an optimal position for your pelvis and your birth. You have to like do positioning and movement and things like that in pregnancy and in labor. But if your muscles are not healthy, and we call it hydrated, not necessarily hydrate because you're drinking water. It's more of a intracellular thing, so it's deeper than that. And I won't go into it for the just for simplicity, but your muscles can become very restricted. So even though you're doing all this position and movement, if your muscles are restricted, they are not going to let the bones move, let your pelvis move out of the way, um, really allow your positioning and your movement to be effective. So you have to address your soft tissues, which are your muscles, your ligaments, and especially the fascia that runs through the body. So as you grow with your pregnancy, there's a lot of changes going on in your body is forced to accommodate this extra load. And it can, by nature's design, but we don't really have um, all the same type of lifestyles. Some of us are very sedentary, some of us are super active, and there's anything in between. And when we are growing a baby, our body is trying to accommodate, but it may not be prepped or conditioned, whatever word you want to use, to make this happen smoothly. So you may feel pain in your pregnancy. You may have discomfort that you just can't seem to get rid of because your body is resisting the growth. So this is why body work with a structural integrator or a certified rolfer is really fantastic, even when you're not pregnant and during your pregnancy, as well as pelvic floor therapy, as well as nutrition, making sure you're eating high protein and collagen type with like collagen type of foods, especially if you have a vegan diet or some type of plant-based diet where you're not really considering eating bone broth or something like that. So you may have to do extra research to find out what it is that you can definitely eat on a regular, consistent basis to keep your muscles and skin very pliable and healthy from your diet. Your diet is really a very important part of the health of your tissues. So when you have released fascial restrictions, you've had your pelvic floor work done where you are, you have a balance in your pelvic bowl, you are breathing right for your it's just to help with your pelvis because when we breathe it goes up and down type of thing. And then you're on point with your nutrition, that sets you up for not tearing. Is it guaranteed? No, it's not guaranteed, especially if you push a baby out super fast. sometimes that that intense um, pressure and that intense like need to stretch to fit the baby through, the skin is not prepared for it. So it may not be able to do the stretching uh, in enough time. So it would tear when babies come out too fast, but that's not all the time. That just happens um, in some cases, but not all. So having a baby too quickly doesn't necessarily mean guaranteed tear. Okay. Then when you have the 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 mineral oil with the warm compress, it just promotes the circulation to make sure your soft tissues got what they need to stretch and open and then bounce back, right? And that's really like what it takes to, I would say, prep yourself. Some people don't know they're prepping themselves. They just have a good diet. They just um, like do certain things because that's, you know, what they do, and they don't think about it. And it is like, I guess it's a bit of a mystery for some, like why do some tear and why don't some tear. It's not always like guaranteed, but this would really set you up to help with either not tearing or minimize the type of tear. When you get the body work done and your body is in a good balanced state, the baby will be in a optimal position. So the smaller circumference of the baby's head will be the presenting part. So your body doesn't have to really open more than it needs to. So that will minimize a tear. The skin with a healthy, nutritious diet with, protein and collagen is going to help with that. And then some warm washcloths, or, this is why, like, when women birth in a tub, they have minimal tears because their skin is already lots of good blood flow, and it's soft and stretchy just from the warmth of the water. And so that's why I do use the warm compresses. They're always like, I wring them out pretty good. I don't, it's not really wet and drippy, but it's warm and steamy, I guess you could say, to help with that. So if you're thinking that you want to at least try these things in your, if you're thinking about having a baby, definitely start your body work, structural integrator, certified welfare, or pelvic floor physical therapist, at least an evaluation. And then pay more attention to your diet. And if you are already pregnant, it's not too late. You can still get the body work done. You can still see a physical therapist to at least evaluate your perineum to see if there's anything that you could do to um, help. There could be trigger points that you didn't know are down there, and they can help release those, which will definitely help with your birth. So it's a lot more than just like mineral oil, if you want to be real about it. There is like prep work if you want to do your best to keep your, we call it the perineum, but basically it's to keep your vagina intact and not have like too deep of a tear, because it's the depth of the tear that causes the issues, not the little skin abrasions that can happen with tearing. It's when it gets into the muscle, and the deeper it is in the muscle, the more problems that you do get as you recover in postpartum. So if you have any questions about um, tearing or how not to tear, and you're not really sure like what this body work is I'm talking about, or maybe you can't get to a pelvic floor physical therapist, what can you do? Just write in the comments. I'll answer your questions and help you have a really like good birth experience, because that's what I do. I'm very passionate about helping women have, the best experience that's right for them, and ease fears. That's the biggest thing, is easing the fears before you're going into birth is one of the best ways to create your great birth experience. So I hope you guys have a good night. And anybody got questions, just, hit the comments, and have a good Thanksgiving if you celebrate Thanksgiving. It's coming up.